In presenting this DVD, I am assuming the viewer is familiar with standard transducer positions and movements, as well as orientation of organs on the ultrasound screen, as described in the Tips and Techniques DVD. I also encourage the viewer to optimize the ultrasound image, as described in the Tips and Techniques and General Abdominal Scan DVDs. Any organ or structure can be used as a landmark to help locate other organs, structures, or lesions, especially when the desired organ or structure does not have a normal appearance. In this video, the gallbladder is followed to the cystic duct. Then the cystic duct is followed to the common bile duct, and the common bile duct to the duodenum. Color flow Doppler can be used to help identify the common bile duct because it will not show color. The following are landmarks to help identify the liver. From a ventral midline sagittal transducer position, we refer to the hyperechoic or bright white line cranial to the liver as the diaphragm. This hyperechoic line is actually an interface between an air density of the lungs and a fluid density of the liver. The diaphragm is cranial to the liver. The anechoic gallbladder is part of the biliary system. It is normally to the patient's right side of the ventral midline and surrounded by liver. In this ventral midline sagittal view of a cat liver, an arrow is placed on the hyperechoic line of the ventral liver capsule. Then the arrow is moved to falciform fat ventral to the liver. Normal liver is usually the same echogenicity as normal falciform fat. The stomach is caudal to the liver. The stomach in the cat usually ends at the ventral midline and may not be seen unless you fan or slide to the patient's left. The stomach extends further to the patient's right side in the dog. This is a 12-pound Yorkie. Now that we have finished examining the gallbladder, increase depth to fill the ultrasound screen with gallbladder and liver. Fan or slide the transducer along the rib to the patient's right side till liver disappears. Then reverse directions and fan or slide along the rib to the patient's left side. When you reach the patient's xiphoid, you may need to jump over or slide around it. Continue fanning or sliding to the patient's left till you have seen all of the patient's liver. Reverse directions and slide to the patient's left side of the xiphoid. If you see or suspect a liver lesion, rotate the transducer to a transverse position. Fan the transducer as far cranially as you can. Then reverse directions and fan as far caudally as you can. When finished, rotate the transducer back to a sagittal position. separation and recognition of individual liver lobes is not usually possible unless abdominal effusion is present. For surgery and repeat ultrasound examinations, it is important to have a general idea of where lesions are in the liver. There are 4 major liver lobes in dogs and cats. In a midline ventral transverse view, the right liver lobe is to the patient's right side of the gallbladder. The right liver lobe is divided into 2 sublobes. The lateral wall of the gallbladder is attached to the medial side of the right medial liver lobe. The right lateral liver lobe is in contact with the right abdominal wall. The quadrate liver lobe is between the right and left liver lobes and in contact with falciform fat at the ventral midline. The quadrate liver lobe is in contact with the medial wall of the gallbladder. This transverse view of a 6-year-old cat shows a hypoechoic quadrate liver lobe suspected to be caused by a thrombus. The left liver lobe is usually the largest liver lobe. It is also divided into 2 sublobes. The left lateral liver lobe is in contact with the left abdominal wall or the medial stomach wall. The left medial liver lobe is in contact with the quadrate liver lobe. This still image shows a transverse view of the liver in a 4-year-old dog with anorexia, weight loss, and an elevated serum calcium. The image shows a hypoechoic hepatic lymphoma of the left lateral liver lobe. The caudate liver lobe is in contact with the dorsal abdominal wall. In cats, the caudate liver lobe is usually visible from the ventral midline sagittal view. In dogs, the stomach often blocks the view of the caudate liver lobe from a ventral sagittal position. The caudate liver lobe is best seen in a right lateral sagittal view. The right kidney lies in contact with the renal fossa of the caudate liver lobe in dogs.